Wonderful. Good afternoon, everyone. My name is Audrey Adanis. I am the Deputy Director of Miami Homes for All. We are a nonprofit organization seeking to increase affordable housing and access to it here in Miami-Dade County. We believe everyone deserves a safe and stable place to call home. And I would love to introduce the team that is here with me today. Reina Milfort, our Director of Housing Advocacy and Community Engagement. Ivan Pinedo, our Housing Recruitment Director. Reber Menz Coriolan is our Youth Program Coordinator. Erica Scott is our Housing Policy Analyst. Govind Shrivastava is our Director of Capital Solutions. And I think those are all the team members that are here with us this afternoon. And so with that, I'm going to pass it over to Reina to kick off this webinar, introduce our speakers, and to get this party started.
Good afternoon, everyone. Reina Milford. I am the Director of Housing Advocacy and Community Engagement at Miami Homes for All. Really excited to be here with you guys today. Happy New Year. And really appreciate all of you deciding to come on January 8th, kicking the year off with a bang. So really excited to see everyone here and having this discussion. Some of our speakers today are some really, really amazing speakers that have a lot of experience with talking about homelessness. So one of the people that we have that will be talking is Matt Marr from my alma mater, FIU. Go Panthers. We also have Amani Saria from the Homeless Trust at the county. And then we also have Malena, who I think is running a little bit late, but she will jump in when she's ready. So with that being said, we're going to start and we're going to kick right in. Just want to let you guys know that if you guys have any kind of questions while the speakers are speaking, please feel free to add it in the chat. And then we will have time at the end for anybody to ask some of these questions. So please hold all questions till the end. Okay, so we're going to start a little bit with some of the new HUD updates. I know a lot of things have been going on. So these questions are for Manny and Matt. But the first question is, what are the most significant changes that local providers need to understand about these new HUD changes? And what are the current biggest challenges for Miami-Dade specifically?
Is the mayor back now? I'll answer. I'll probably have to be driving in about 2 minutes, but I'll start the answer. HUD is moving in a direction that's away from permanent housing and into creating more opportunities for people who need treatment, so transitional housing. As part of the president's agenda from the very beginning, he said he wanted to get people off the streets. He felt people are the current models were allowing people to languish on our streets, and he put forth a NOFO that proposed cutting permanent housing to only 30% of our inventory. The National Alliance and some stakeholders sued HUD and said, one, they couldn't put out a NOFO this year because last year's NOFO was a 2-year process, but they also said that was too dramatic of a change, and HUD came back and said they republished a second NOFO that allowed communities to apply for an additional 30% of permanent housing, and that was also rescinded by the courts. And today HUD is supposedly going in front of the judge in Rhode Island that's hearing this lawsuit, and they're going to make an official response. So I technically don't know whether or not they're going to pull their NOFO back or try to issue a third attempt at the NOFO. 84% of our permanent housing, of our inventory in Miami-Dade County of HUD COC dollars is permanent housing. Yeah. So whether it gets cut to 30% or some 60% or somewhere in between, it would be a dramatic decrease. So we're already talking about who we try to preserve in permanent housing, like who's the most vulnerable within our population. Providers, we issued a competitive process and the providers a lot applied for transitional housing. So we anticipate, even though we're losing permanent housing, that we'll have a different type of programming that's up to 2 years with the transitional housing program. And I'll stop there and I just give Matt, if you want to add to that, give him a chance.
Sure. Thanks, Manny. And hello, everybody. And I wanted to thank everybody at Miami Homes for All for organizing this, especially Audrey and Reina. I don't have a whole lot to add. I think Manny has more of the inside perspective on this. But, some things I've heard, I'm a strong proponent of supportive housing subsidies in any form. And I think if they're not there, transitional housing is going to be tough to make work. But from what I've heard from the National Alliance to End Homelessness, they estimate if the initial NOFO was implemented, they estimated about 170,000 people across the country would lose their housing. And in Florida, the estimate was about 7,000. They didn't do it all the way down to the local level, but I just really wonder about if people lose housing subsidies, where will they go? And it's really I know the trust is trying to take this in a positive direction, but I'm concerned about that.
Thank you, Matt. Malena, I know you just came, and welcome, and we're so excited to have you as one of our speakers as well. I wanted to give you kind of a little bit of context of what we're speaking about right now. Manny gave an update about some of the significant changes with the HUD updates regarding the NOFO and some of the current biggest challenges for Miami-Dade County. So I wanted to see if there any give you an opportunity if you had anything to add to that question.
Good afternoon. I'm sorry I'm late. I was caught in something else and rushed into the office, but I'm sorry about my delay.
So
I haven't heard Manny, but I guess I can imagine because of listening Matthew, more or less what you were talking about. We have some experience in the county in Miami-Dade with shared housing, which seems to be kind of the direction that somehow we might be, taking with the new HUD guidelines. And we've been successful. We went from one house in 2017 to 28 house and more than 180 people that were unsheltered and are now under a roof, sharing not only the houses but also the rooms, like 2 heartbeat per room. So I think we are kind of Hermanos de la Calle with this model is kind of a proof that this can be done. Even it's tough for people to choose, but when you don't have any other choice, for a lot of people, it's out of the question that it's better than being outside. So that is something that I can add. And I don't know if you have any question or anything else. As I came in late, I'm not sure.
You're all good, Milena. That was the first question, so we have plenty of questions for you, and really, really appreciate your perspective on this as well.
Okay.
But back to some of these things that you guys have been talking about, and we're learning a lot about supportive housing and transitional housing, and really want to talk about what are like the best practices for prevention of homelessness. And we really want to highlight the current needs and some of the evidence-based models for supportive and transitional housing. So this question is for any of the panelists. How should Miami-Dade expand supportive housing to meet the needs of chronically homeless residents?
So we're looking at developing, we did for the youth homelessness population, we developed transitional housing standards. So we're looking at developing transitional housing standards in case we're looking at starting programs in May, June, July, and August. And so that's going to be a community conversation about what that, what are the best practices. You named prevention. I don't know if you intentionally did that. We're selected as a right at home community when we're working with the Leo Institute on looking at the best practices on preventing people from becoming homeless. So those are two things that are happening in the early parts of this year. That's going to impact the work that we do. So I hope that answers your question.
Thank you, Manny. Any other panelists, Matthew or Milena, if you want to add anything to that?
Sure. I guess the question was how to expand supportive housing, and I think maybe Miami Homes for All and Manny and people who work in the housing sector have more technical knowledge about how to do that. And I know it's hard, and I know the trust has set a goal of like 1,000 units and is making progress towards that. But I just think there's a need for more and more, and that 1,000 units is great, but we could, to really make a dent, there would need to be it would need to be scaled up even higher. But I think places like Hideaway Bay are a good example that have been successful in overcoming NIMBY and stuff like that. But I think we need, and probably this isn't even an exaggeration, but like 100 Hideaway Bays or something like that.
Well, we will have people from everywhere if you have 100 and hideaways. I think I must disagree. But anyway, I think it's a nice model. I think that the support services are never enough. So what I think it's a key component is like the network. Sometimes we have lots of resources and providers that, they have the money, but they don't have the referrals to serve those and use that funds. I think it's key that mostly the transitional housing providers, the permanent housing providers, even the shelters, the emergency housing providers, to avoid people being kicked out because they have alcohol on site. Because, just a peer helping that person maybe will make him understand that he cannot have the alcohol inside or something like that. I was talking with Vicky this morning about how the government center is so crowded and why the people do not last in shelter or in housing, because we have people that were placed in permanent housing that are back out there. And I think the resources we have the resources, and we need to work on the networking and the connection between providers. Although we have a nice continuum, we are really trying to teamwork everything. For support services, mostly talking about drug abuse and mental health, we need to be more connected. We need to better understand who is who in the continuum of care, because I'm sure there are, partners that would be able to provide the support services that a case manager cannot give. A single case manager or two case managers for a whole building, you cannot do it. So you need to know who to call, who to connect, have them on site. I think that's a key component that we need to work on.
Thank you, Milena. And to that, and the follow-up question that I have for you is in regards to that is, when is transitional housing the most effective intervention for some residents, and what models should be prioritized?
Let me just say that this conversation has been an indication of why there's no one size fits all. And yes, we are still acquiring properties. Unfortunately, with this new agenda, we'll have to potentially use those properties in a way to protect people that otherwise would be entering homelessness from existing permanent supportive housing subsidies that are reallocated. And Melena's right. Thinking about shared housing so we can have the greatest impact on preserving people in housing is something that we are talking about. Not so much because it is an evidence-based practice, But it's not a one size fits all. It's just we're thinking about that because it has the greatest impact right now. And so yeah. And to answer your question about what transitional housing models work the best, I think we're also limited by what HUD is looking for. So we have to provide what HUD is looking for. So they want people to get back to work, and so they're imposing service participation requirements. So if we want their money to build this transitional housing program, uh, we're not necessarily looking at journals about evidence-based practices and what we might normally do. We are kind of hobbled into this hole of complying with the funding requirements. And so they want people to get back to work. There's some protection for seniors because they acknowledge that seniors potentially might not be able to get back to work, and disabled persons. At one point, it was physically disabled, but HUD, after this lawsuit, has recognized any disabilities. So yeah, it's a unique environment that we're in, and it's all led by the Cicero Group. They're advising the federal government about what changes needs to be made because they believe that because homelessness is growing in almost every community, they believe that a really significant change is necessary.
Thank you, Manny. Malena or Matthew, do you all want to add to that?
I am especially worried about the elderly because transitional housing is really or the people who are in fixed income and really cannot have the ability to work because of their age or a real physical impossibility. Although they are being prioritized, putting them into transitional housing is like, what will happen after 24 months? They will still have the same check, the same income. So it looks like no-brainer that, they are gonna go or either back to the streets or, it's impossible to improve their income. So that worries me a little bit, and I hope that 24 months from the start of whatever transitional programs, we will have a solution for them.
Thank you. And I know we're speaking a little bit about, some of the system gaps and in the supportive transitional housing pipeline. But also to that end, what are some prevention strategies that would work locally? Is it better with diversion, mediation, rental assistance, eviction prevention?
Well, I didn't have any comments or I had a comment on the transitional housing question before
Sure.
that. But I agree with what Milena was saying. There's some groups that's kind of at the end of transitional housing. If there's fewer housing subsidies available, what are they going to do? And I know this is dated a long time ago in a different place, and I know it's toxic to say the words Los Angeles, but I did a study in Los Angeles 20 years ago of transitional housing, and it was a very small group of people, but the 2 years that they spent there was kind of like waiting until they qualified for a housing subsidy. And a lot of people struggled. I know that Manny was saying that they're talking about, how to improve standards and develop, good programs. But I think the general idea is to, try to get people to find jobs, and then you save that money and use that money to rent in the in the mainstream rental market without a subsidy. And this study I did 20 years ago for my dissertation, I found that nobody exited that way. They all just kind of found a way to get a housing subsidy, or through their family, they reconnected with a family member. But maybe something like combining with shared housing or something like that to reduce the cost of renting in our current rental market might be helpful.
I mean, all those things that you name, Audrey, are appropriate and necessary. The difference is that HUD is cutting not just the COC program. A lot of the housing authorities are in shortfall, so they're not taking referrals. HUD's even acknowledged, like I think when they did the NOFO competition workshop, they said about 50% of people need to exit transitional housing. And in the NOFO, it also says 50% needs to exit transitional housing to positive destinations, and 50% has to increase their income. To me, that's a recognition that that model has far worse outcomes than permanent housing, because they would never suggest that 50% of people exit permanent housing, because they know that's a model that usually retains people significantly. So, and you mentioned prevention again, and I'll tell you that a little bit more about Right at Home. I kind of just blipped mentioned them, but Right at Home is part of a study that wants to demonstrate to the nation that the best practices for prevention. So they chose 10 communities, Democratic-led, Republican-led, Indian tribes, small communities, rural communities, big cities. They chose 10 communities to do this model. They already implemented in one community in San Jose before coming out and reaching out to these other communities. And essentially what they were saying is, we need to fundraise and we need to be able to do things that the government won't pay for in prevention. So maybe put some gas in somebody's car, help them make a car payment, things that might be trivial, but might go a long way in preventing us from having to issue additional subsidies because they lose their job, or, and so this has a little bit of a fundraising element to it, and combining like flexible fundraising dollars with government dollars, but it also has the goal of making government dollars more flexible.
Thank you, Manny. And actually, to that point, and I know we're talking about it from the provider standpoint and kind of from the policy standpoint, but this question is also for Milena or Manny. What do the clients and residents say that they need the most when they're entering the supportive house or transitional housing? And how can providers adapt models to better reflect those needs?
Ale, you take this one.
Is that me? Okay. I think it's mixed, right? We work with a mixed population, so a lot of people, even if they are homeless, they recognize the dignity of having a job. So finding jobs is really, I think that the new HUD guidelines and whatever, it's nice to think that, I mean, apparently it didn't work in the past, but it would be nice to think that we can get all these people to be productive members of society. And they see it like that too. We see this, our shared housing thing is rented. They have to pay very little rent, but they have to pay. And you see how proud they feel of the fact of being able to pay for their roof. They come from the streets. I mean, it's not that, stable people. No, it's not the nephew of someone that, no, it's people coming from the streets. And they feel really, really a lot of dignity of the fact of being able to afford to pay. So the ones that we take a lot of people coming also from homeless to programs, treatment, and then they come to our houses. And the first month would be paid by the facility, but then they have to find a job, and that's when you see how the person feel that they are, they are moving forward. So finding a job, career opportunities, I think are key. It's a key component on the success of any of these programs. Even our little, small, tiny share housing program, we are struggling with that. It's not easy to connect people because the application processes and everything are so hard for them. So you need to be on top of them or relate them with a provider that can help. So the job opportunity, I think it's something very important to take in consideration. And for the adult population, the elderly population, you need to get them ready for the moment that they are not going to be independent. So you need to be thinking on that from the very beginning, from like, if they are 70, probably when they are 75 or 80, they will need other type of services, and probably none of these transitional shelters, share housing will be able to provide that. So you need to get them ready. And that's a preventive thing that it's important to do with the elderly. Hopefully they will keep all these long-term care assistance because that is also something that we don't know yet, but for the moment they are recognizing the importance of that, and even if it seems very expensive, it is necessary. And unfortunately we have a lot of people that are alone in the homeless population. Nobody can take care of them, so they need to be taken care by a facility, so we need to get them ready for that too.
Thank you, Milena. And Rick, I see your hand is raised, but we're saving all questions till the end. So if you do have a question, please put it in the chat and we will get to you as soon as possible. Milena, that's actually that's really good information and something that I also wanted to talk about, and you touched upon it a little bit about strengthening provider-client communication, and really make sure that that is happening. So how can we make sure to ensure that these residents feel supported throughout all of the case management and making sure that there is retention, and all of the housing placements of how what do you, in your opinion, or in Manny's opinion, or in Matt's, how can we strengthen that provider-client communication? What are some things that we can do as providers?
Yeah, I think Milena can talk excellently. Her program has a great ability to engage people in a model that very few organizations have been able to. And also Matt, through his experience with different communities and that he's looked at and researched, can probably talk about that. I will say that we encourage a minimum standard for support service budgets so that organizations are not doing too much of a light touch support services. So whenever a provider submits a request for funding from us, we definitely encourage that the supportive services at a minimum cover what their clients are going to need.
I think the population that we are working with, it makes it difficult for the support services to be successful somehow, because you might knock on the door of someone that is on a scatter site, and they won't open the door once, and maybe the second time they won't open the door again. And on the meantime, they are maybe going down the, or maybe, deteriorating their health or using drugs or whatsoever. So I think support services are never enough. That's why I was saying that it's so important and it's also very expensive. So it is so important to connect people with resources. But again, this is a population that you might knock on their doors many times and they won't open the door. So how do we get them to listen to us, or that you might connect them with a resource and they wouldn't go to their appointment once and they won't go to their appointments on the second time. So I think and bringing the providers to the places is not easy. Everyone says, oh, Steve, have him call me and I will give him an appointment, and the appointment will be for 2 months from now. So it's not easy, but I think it's a lot of patience needed here, and I think we have very good providers. I'm not talking about, we don't have permanent housing, we don't have support services because we don't have money for that in our program. The program is not government funded. It's like people pay for their rent, and we have some people stolen from the other budgets to kind of follow up on people. So we have now, it's interesting, we have a couple of houses that are funded and we are getting like permanent supportive housing for them. So the people would go back to the bus stop once and 2 times and 3 times. And I'm telling them, my Christmas gift, I want Omar back in the house. So that's what it means. I mean, you have to be very persistent, very passionate about it. And we are missing that part of, you need to take the person to the appointment. You need to take the person to make that call. And you need to listen what they tell them to be able to help them progress. So it takes a lot of human effort. And I think we have a lot of good people doing this in this continuum. So we need to trust on that. Manny, are you happy or not?
I'm always happy with you. You guys are great.
Thank you. Matt, do you want to add anything to that before we move to the next question?
I don't think any, excuse me, nothing major, but I've had the privilege to go out with a number of outreach teams in the county, and I was looking and interviewing people who got vouchers and placed into housing, and I really admire Melena's team and the other teams and how much work they put into to helping people. And we did it's called Photo Voice. We did a Photo Voice project where we took people who had been placed in housing, just gave them cameras and had them document their lives and write captions and stuff about it. And so I heard many stories about Milena and her team, beyond what I observed, but kind of to Milena's point, I think, is still some were saying, oh, I can't get in touch with my caseworker at this time or something like that. So it's just really hard and takes a lot of dedication, patience, and I guess continued follow-up to make sure people aren't, just to throw out a sociological concept, but it's called tolerant containment, when you just put somebody in housing and just like let them just let them do whatever. So I think Milena and some other groups work really hard to provide those supportive services.
Thank you. And so I think a lot of us and all of us in this Zoom room, as well as our panelists, we want to talk about like our collective priorities for addressing homelessness. How do we refocus the conversation on the shared goals needed to address this issue community-wide? So this is a big question that I'm about to ask. Obviously, everybody can have different answers, but and very big open-ended. But the question is, what should be the top collective priorities for reducing homelessness in 2026?
Listen, I understand the federal government wants to shake things up because there's still a lot of people experiencing homelessness. I just don't think it should be on the backs, because they can't print money and they're not thinking about investing new dollars in this. So it's coming on the backs of people that are already been stably housed for some time. And so, but a lot of positive change comes from these sometimes shaking systems up and looking at it in a different way. So again, I love to hear, I love to like stop talking about just what my thoughts about what's happening, and just love to hear from you guys what those priorities or goals should be, because this is new to us, and this is a work in progress for us. We have to design programs now that will work well, even though we have proposals from agencies, what they want to do. It's not unusual for us to go circle back with them and do training and on best practices.
Thank you, Manny. Milena?
2026 seems like December next year. This year is going to be out there anytime soon. And when you think, we've almost there, we're almost there, they come from everywhere. We are dealing with families. We have big issues with families coming from other towns. The climate is so good here, but I always think like that coming from a private, even if we are now engaged with the Homeless Trust for certain activities, I think it's key to have the whole community involved. We can not only count with the continuum of care and the providers, we need to count with the commitment of the government and the people that live in town. I mean, I would say from one extreme, like, feeding people, it's good at a certain point out there, right? And we do that, I have to say, because we know they have to eat and they are out there and they have their physical needs. But at the same time, as a community, we might need to come to an agreement. It's not going to be 2026. It's gonna take some years. But if we have the facilities where we can, help these people in. I'm pretty sure that together we can help 1,068 people out of the streets. We have a big budget. We have a very committed community, not only the Homeless Trust and the providers, but also a lot of organizations that are willing to help too, like private nonprofits, donors that really wants to cooperate with this solution, mayors that wants to cooperate, or former mayors. So I think that it's not gonna take only 1 year, but we can do this in Miami-Dade County. We will also need like the police involved. We need a lot of resources. Mental health and stress, substance abuse are the key components of the problems out there. 75, 80%, I don't know. Does anyone has the number? But it's very close to that. So we need probably facilities to help us deal with that, even if it's inpatient, to stabilize and then get outpatient and then get them, realize that being housed is better than working for the FBI outside, So, but we need some work before. It's not going to take only 1 year, but I think it's doable.
Yes, and we know it won't take 1 year, but the question was much more what should we try to focus on this year? Not that we can solve this in 1 year, but wanting to know what you all are focusing on this year to kind of move that along. So appreciate all the insight and all of the expertise that you're giving. This is really, really helpful. Matt, do you want
I
to add?
think Malena, I just want to add that Malena's a good example of what we could be doing, where she's not waiting for government or funding. She's as a community person has taken on a problem. Of course, we try to reward her and grow her program out and give her some shallow subsidies so she could do more of what she was doing without our help. But that is something that we've talked about. She has great outcomes. She's been able to engage people in a model, in a relationship where they're accepting things that they wouldn't otherwise be accepting through some of our other providers, like the shared housing approach. So I've talked to Vicky about potentially doing more of a shallow subsidy for providers and training outreach providers and encouraging them to do some of what Malena's already doing. So just wanted to highlight that.
Thank you, Manny. Matt, anything that you would like to add?
No, I think everything that Malena and Manny have said is, important, and that a lot of different things need to be done. But I always come back to, supportive housing and housing subsidies. And I think the national government is so big in this, the federal government. And I know that with the new NOFO, that paints kind of a grim picture, but and I don't know if this is kind of out of the scope of thinking here, but I did a lot of I was hired at FIU to be a sociologist of Japan, so I studied Japan and homelessness there, and they reduced street homelessness by 90% over 20 years, and it stayed that way, and it was all through government subsidies of housing and giving people income. And I know there's more to the picture than that, but I still think that there would need to be a strong role, and maybe even it's the issue of people coming to Miami relates to this. So we would need to have that kind of expansion throughout the country. But with the current NOFO, it doesn't look like that's the direction we're going in.
Thank
On
you.
that note, I'll tell you, Judge Leifman he visited a community, I want to say it's Denmark, but don't quote me on that, where they're doing things like treating people with quality antipsychotics early on, and bringing people, giving them housing and wrapping them around with services, and reintegrating them into the community in a way that's really impactful and meaningful. He says the program does so well that they barely have clients. Like they do a really good job in tackling issues early on, rather than letting them build on to different traumas of becoming homeless and different issues that sometimes have become harder to ameliorate. So, I mean, I can't speak intelligently about it because I just kind of like quick conversation with him about his experience with his community. But yeah, maybe we talk to him and invite him so we can learn more about what other communities are doing, what some creative work around preventing the person from just not trusting the system.
Thank you. Thank you, Manny. My last question before we open it up to Q&A, because I want to make sure everybody has time to ask some questions. And I know Milena had touched a little bit upon she's worried about our seniors. But um, what other populations should we be need to be prioritized in this time as well?
Any one of us can answer that thing, but I mean,
Yeah.
I mean, we're thinking about using like tools to decide who's most vulnerable, but obviously, regardless of age, so there are, seniors, I understand, their the concern and their unlikeliness to go back to the workforce. Uh, youth, having a potential penetrating the workforce, and that can be problematic too. People with underlying mental health issues, people with addictions. I mean, it's not just veterans coming back from war zones with post-traumatic stress disorder. I mean, it's really hard to just pinpoint one, and not and it's funny, but not everybody deals with the same things differently. So you can't just say everybody who's labeled with major depression is vulnerable. Individuals, have different levels of resiliency, and so it's really hard for us to tackle that with like uh, just kind of like a map of a predictability. But yeah, I mean, we so I would say anybody that can't afford rents in our community is vulnerable.
Yeah. And family with children too, like recurrent, for some reason something is not working and they they are homeless and then they are referred to permanent housing and they are back homeless. So clearly we are not going to the bottom of the solution there. But anyway, I would add that there is like I don't know how to say it in English, but like a something that is not possibly to be solved within a continuum of care that service the homeless, that are certain homeless people who are disabled in a way that none of the services that we can offer are enough. So there is like and then if you want to refer them to better services or to more appropriate services, it takes a long time. So they would be out there in a wheelchair, not being able to be independent to go to the bathroom or shower or everything, because they need a higher level of care. And that is something that we cannot solve within the continuum. And it looks like there is kind of I don't know how to say, but como un gap, there for that population. They should be prioritized, but we have nothing to offer. You cannot put them in an apartment. You cannot put them in share housing. You cannot put them in a shelter or in transitional housing because they are not independent. So those, that connection with other type of resources also should be considered as a priority, not to house them, but yes, to house them. It's a connection to a resource that will end up housing them. But on the meantime, they are out there.
Thank you, Milena.
Mm-hmm.
Okay, so these are all of the questions I have for you all. So what we're gonna do now is we're gonna move to Q&A from the rest of the Zoom room. I'm gonna start with the questions that I see in the chat, and then after that I will start and Reber will help me out. If you guys have any questions, please feel free to raise your hand and I will unmute you for the question, and we'll go from there. So the first question that I had seen was the question from David. David's question was, how do we authentically incorporate the voices and perspective of people with lived experience of homelessness? A best practice is to ensure that people impacted by homelessness policies are at the table. Anybody can answer this question, any of the panelists.
You know what? You threw me off because I heard, I'm driving. I'm sorry, I'm distracted a little bit, but I heard this question is for David, but I think you said from David, and I disconnected there. Can you repeat the question?
Yes. From David, the question is, how do we authentically incorporate the voices and perspective of people with lived experience of homelessness? A best practice is to ensure that people impacted by homelessness policies are at the table.
So I would love the answer to that question too, because we are attempting to do that. We do a relatively good job. So through the Miami Homes for All, for the past 2 years, we were able to use some planning dollars to pay for lived experience. Miami Homes for All leverages money from the Children's Trust to pay for lived experience to help make decisions around youth homelessness. We also have a few, our board structure requires the participation of people with lived experience. We have a lived experience working group. We have I'm drawing a blank on the oldest one that Pauline's involved in, and Miami Homes for All helped structure that. But formerly homeless forum. So there are all these avenues that encourage homeless voices and to take leadership and participation on our board and all that. But I still think that I always had this sense that more could be done, and so we're still looking at ways. We engaged our marketing firm, the M Network, recently to do some ads around on social media around our lived experience working group to try to bring in some new energy because it seems like it's always the same faces. I think Miami Homes for All's got it right in the sense that they kind of revive their lived experience working group every year and they pay them. Those two things seem like a key element. Although I was frustrated every time we were working on something and I lost the whole group. I had to wait 2 months. But it is a way to keep things fresh and being able to pay them is also just such a best practice.
Thank you, Manny. Milena or Matthew, do you want to add anything to that?
Sure. Yeah, I think what Manny said, those are great ideas. And another thing is to, include more people with lived experience on staff of service providers. And I see that happening with the outreach teams that I've been able to go out with. And the National Alliance to End Homelessness has done a lot of research on this, staff with lived experience and how to incorporate their perspectives more because they've been shown to be really effective in accessing a broader population and gaining trust and things like that. But they also point out that folks like that, well, all staff providing direct services generally need more support, but especially staff with lived experience and lived expertise, because they often experience stigma and have limited financial support. And there's challenges getting into leadership roles that would, affect policy as well. So they recommend more professional development for staff that have lived experience, fair pay, healthcare, and other benefits, that kind of support as well. But one other kind of interesting thing I've noticed, and I don't want to sound too critical, is that there's a lot of staff, frontline staff who have lived experience, but when I talk more about it, I think the concept of lived experience has expanded. So it includes, like, if you have a family member who's had lived experience, and it could be not just lived experience of homelessness, but, substance misuse or something like that. And so we have to think about, what does it mean? And kind of what I'm trying to get at there is there's fewer people with like experience of chronic homelessness that get, into these roles. So that's just something that I've been thinking about and noticing lately.
Thank you, Matt. Another question we have is from Ida Diaz. Ida is asking, how is the current immigration policy affecting people in supportive housing with mixed status families?
So I'll take that. And I think Milena should answer that too, because she used to have some funding and help persons with that weren't lawfully present here, and she could talk about the impacts on that. But yeah, when it comes to federal funding, through our state contracts and the feds, we're seeing a move to start using the SAVE system, although HUD has still not uh, figured out how COCs can apply because it's really designed for housing authorities. But we're seeing a move in the direction of starting to use SAFE systems to verify the eligibility of household members. So yeah, so people with immigration issues can be impacted by losing their subsidy. In the past, we don't have enough guidance to know that that statement is completely true yet. In the past, we housing authorities would use systems to determine who wasn't eligible, and the person could still remain housed. They would just be responsible for, they couldn't be subsidized, so they'd be responsible for the rent. So for example, if you had a couple with a one member was a citizen and the other one was here legally, only the members that was here legally's rent would be subsidized, and then the other half of the rent would have to be paid for in full by that couple. And so that's how it used to work. But I don't know that that's going to be the direction moving forward. And yeah, so I see also COCs being encouraged to start checking for eligibility before providing any subsidies.
And that is when you need the private community or nonprofits that are not tied to what the federal government is saying, meaning that, you know, we have mostly in Miami-Dade a lot of people that have been here for a long time, but for some reason they weren't able to do the right thing regarding their legal status, or they had a background and now they need to pay a lot of money to get the forgiveness or whatsoever. So that's where, you know, organizations can chip in and say, okay, we can take those people. You know, because even them, maybe they are on a government check, they are getting their retirement, even they have a letter of deportation and they don't have a work permit. So that's where, you know, someone else needs to say, okay, I will help that population. That is something what we did from the very beginning when the migrants started to come. Then we got some funding, but it was only for emergency housing, not permanent housing. Never permanent housing. So what we would do is provide emergency housing, and then we would go out to the community and say, listen, these people, you know, are staying, they're going nowhere. Nobody's kicking them out until a year ago. So we would help them with some housing opportunities, like for a month or two, and then they would, you know, they will fly. They came here to work and they do what they have to do to protect their children and feed them and pay for their rent. Anyway, things changes. We haven't seen recent arrivals in a while, since last January, and things changed completely. But we are seeing some of those who came during the last administration that are now struggling, and they cannot even be deported because they have nowhere to go. So it's super hard. There is another gap there, and that's when, again, you need Hermanos de la Calle or other organizations to say, I can help.
Thank you, Milena. One question from Dwight. And Dwight, I don't know if you can unmute, but you just put family reunifications with a question mark. Do you want to expand a little bit on that?
Yes, yes. How are you doing, guys? My name is Dwight Thomas. I have a nonprofit organization by the name of Thomas for Them Inc. Um, I see the transitions that you guys talking about when it comes to transitional houses, but there are levels to homeless. You have the ones that's been homeless for a while. You have the ones that's been out of prison. You have the quote unquote drug addicts and things like that. I'm a private investigator. I've been doing this for 13 years. And what I've noticed is I've tried to reunite the homeless with their families. And that's usually through skip traces and background checks. And since 2020, we've reunited 8 families since then. But I do believe that is a great resource to have because I don't believe that we will be able to put everyone in houses. Sometimes families are able to help, whether they're bringing them back to their homes or even providing food, hygiene products, whatever's needed. But we've been dealing with homelessness for over 1,000 years, so we have to be able to utilize different resources when it comes to it. And that's just what it is. So when family reunification is what I meant, that's what I mean.
I'm sure Milena could add to this, but I'll tell you that as part of when a family calls our helpline because they're seeking assistance, our workflow, we have a formal family diversion. So they get sent to a case manager that does a screening and determines whether or not that family has the support systems in place to divert them from coming into our system, or maybe they need to be in our system overnight just because to get them on a plane, to get a family or on a bus, that takes some level of coordination. But definitely we think about that up front before helping any families, and then absolutely the service providers use that as a tool to connect families to resources whenever that's available. But Milena could talk a little bit more in the weeds about her experiences doing that on the day-to-day.
Yes, yes. Dwight, I completely agree. That is, for Hermanos de la Calle, that's the first option, thinking about family network, family support. Reunification for us is, we've been doing this like for 10 years. At the beginning, for, I would say 6 years at least, we were doing it like absolutely amateur. But the first thing you would think of, there is a lot of common sense here. The first thing you might think of is, where is your family? What happened with the family? And we found many people that whose families thought they were dead. They didn't know anything about them for many times. So we used every time of detectivity resources like Facebook and Truth Finder, whatever, to connect with their families and reunify. That was our main priority. And, we didn't have money or resources. So we would just, find the money to pay for that ticket only if we find the family that would welcome back their lost person that was stranded in Miami, lost, or we even reunify an 83-year-old back to Puerto Rico, like after almost 8 years of being disappeared from the family. They definitely thought she was dead, and she was not friendly, so it was not easy. But finally, we connected with her son and her sister. But I completely agree. Before money taught us the word diversion, which is key in this continuum of care, right? Like diverting back to family, not because we want to, we want to get rid of the person, but we want to connect the person with their loved ones. And that's our first option always. And when I say we need to count on the community and the private people and the government and the homeless trust and whatever, I'm talking about the family of those people. Maybe Cubans that can, spend their last time with the loved ones, whoever. But that is at least in Hermanos de la Calle, it's our main priority.
We kind of do want to get rid of them. I say that half jokingly, but we know we don't have enough resources for everybody. So this is definitely a tool in our matrix. Miami Beach uses an instrument. There's a lot of data on people out there because of credit, and they use an instrument that a lot of you might think is invasive, but I just thought I'd mention it anyway. But it basically, if you give them your information, it has like a family tree on it, and it has any email you ever owned. I don't know if you guys have ever seen a credit report for yourself, but I'm like, oh my God, I forgot that email. That was like 20 years ago. It looks at phone numbers, emails, addresses, connections to next of kin. A lot of information is available through this software that they use to have a greater impact with diverting people. And so I know it's going to be mixed about how you guys feel about using something like that. Uh, yeah, organizations do take a really deep dive on finding people information to try to make connections with.
I I would just add, I think that family reunification is great, and the success stories that Milena has shared are are wonderful. But I do also wonder about like the longer term outcomes. And I'm trying to talk to other researchers. It would have to be done at like a national level because, looking if people return to homelessness after being relocated, um, would be tricky to do just at a local level because they've been sent elsewhere. And I know Milena and other organizations locally, they confirm that there's someone there to get to receive them. But it would be great to have more information on the long-term outcomes.
I agree. And many times they come back. I mean, I'm not saying it's perfect, and that's the reason why Miami Beach only does it once in a life, So many times they come back and, oh no, Miami Beach, I'm in Miami Beach, but they cannot do it because they already helped me. So it's very clear we are not a travel agency, and we need to be clear about that. But sometimes it doesn't work. Absolutely. And sometimes you may think that very nice stories, but for example, the lady I took to Puerto Rico, 2 days later, the sister was calling me saying, oh, I don't want Juanita here. It was 48 hours after, and I was still in Puerto Rico. So
Yeah.
the son, and she died 3 years later with her son and whatsoever. But there can be, for a reason, they are not in connection with the family. Many times it's because they don't want to worry mom or whatsoever. But many times families kick them out once. And families, when they find, they are alive, they are happily ever after, but it's not ever after. Then the person goes back home and again, maybe using drugs. So it's not perfect. It's not easy, but in many cases, it has been very, very successful and rewarding, mostly for the family and the people, for us too. But it can be tricky. I agree, Matt. It's not always a success.
Yeah, I definitely agree with that. But every family have its own issues. You know what I'm saying? We definitely keep that in mind when we do our family reunifications. Out of the 8 families, 6 of them still stayed together. The two, you're not gonna be able to help everyone, but those was great outcomes. But yes, family have their own situations and things like that. Yeah, I forgot what I was going to say next, but I forgot. Yeah.
I think this was a good compilation. This has been a good group because Malena will say something, and I was like, I failed to say that, and then Matt says something too. But as soon as Matt started speaking, like if we were an old married couple, I was like, oh yeah, that's a great. I knew where he was going, and it's true. Most of our returns to homelessness, from exits to permanent destinations in our continuum, come from these types of connections. It's not when you give somebody a subsidy, it's when you reunify them with family and friends that they end up coming back. So Matt's absolutely right about that. It doesn't always
But
work.
that's mostly when you send them with family locally. If they travel to Seattle, it's difficult that they come back. Anyway, you are right. Absolutely, it's not perfect. Unfortunately, because families are families, and we have our problems, and it's not easy to deal with a person that maybe have even worse problems. So, but it's the 20% relapse for Dwight. It's good. I think it's a good number. So keep it up.
Yeah, I think that same mindset, even when it comes to family, a lot of people that's on the street, they would rather not go into a program because of the program rules. They have curfews. So most of them would rather be on the street. That's the same type of energy when it comes to being with family. You have still have family worry about the family rules and things like that. So those two balance out the same way. But we still got to be able to keep it still going. So yeah.
Well, thank you so much, Matt, and thank you, Elena. The next question, and Beatrice, I know you have something, and then David, I will get to your question after. Beatrice, you mentioned something about families or mothers with children. Can you go a little bit of on that for elaborate on that for the question? And then after that, we'll go to David. We'll have about 15 more minutes until this webinar is over. So just wanted to let everybody know that. But Beatrice, go ahead, and then David, I will take your question after.
Yeah, with this, I, what happened with a woman that, for example, is alone and have two children? That person probably cannot share a room with somebody else. And the other thing is, do you have the possibility to have some help psychologically for these people? Malena?
Yes, that's when we connect the people with local resources, and we have several providers, even people who go to the houses. We have a specific house that is for it's a Florida Association of Recovery Residents certified home, and we have peers coming to the house and working with each of the residents to, help them persist and persevere in their recovery. So we don't have it, like we cannot afford to have it. So that's when we need to connect them, and that is when it is so hard. If you don't take them to the appointment and wait them outside, or it's difficult for them to follow up on treatment or on psychological therapies, but we don't have that in the houses, but we try to connect the people. We have a lot of elderly who go to clinics, and so we talk to the case managers in the clinic and ask them also to connect with the therapist in the facility, or to do a referral whatsoever. About the families and moms, single moms, it's difficult. I have to tell you, it's doable. We had houses when we were helping the migrants. We had houses like with 3 or 4 rooms, and each family would be going to a room and sharing the common areas. It was completely transitional. It's not something permanent. It was like 60 or 90 days, so until they were able to stabilize. But we did it. We also have a maternity home, a shared house for mothers that are pregnant, and when the babies are born, they share a room, and your baby is crying, and I am using earplugs, or however you call it. But when you are pregnant or with a small baby, and you are out there, you will prefer to share in a nice house. We try to to have settings that are really like your house or mine, like with their kitchen, their laundry, in a neighborhood where we would live. I don't know how to explain, but it's not in the middle of the jungle. That's what I'm trying to say. Close to a bus stop. It has to be like that, because if not, people may not choose to use it. So where is it? Is it close to a bus stop? So you need to give the good ones so that they can accept the bad one that is bearing with the snoring of the roommate, for example. But it's more difficult for moms, but they also sometimes go into shelters that they have to share a room. So you can also do the housing. It's not forever. We try to be a trampoline, like something transitional, so that the mother can, move forward, like after a certain period of time. It's not always easy, but that's the idea.
Okay.
Thank you.
I know that is difficult. It's people who are to begin with, the situation of being homeless already, it makes something to your mind. It fills your mind full of depression, basically. And if you are depressed, you cannot go any forward. So it's very important to have some help that way. Thank you.
Thank you, Beatrice. Thank you, Milena. The next question is from David. David says, should we advocate for county-wide adaptive reuse policies to convert unused buildings and spaces into housing? And I don't know, David, if you wanted to add to that question.
Yes, there's actually several localities. I believe Dallas City Commission may have passed an ordinance about 6 months ago offering, I believe, maybe tax incentives or other financial incentives to developers, to private developers, to convert existing buildings into housing spaces. And so they're simply providing incentives. But I believe Miami Homes for All may have conducted a study a couple of years ago, and you guys can correct me on this, that show that there are I believe 5,000 empty lots or unused buildings throughout the county that could conceivably be converted into transitional housing or even permanent housing. And that theoretically could, if not end, significantly improve our own homelessness crisis. Does that make sense?
Yeah, it does.
I've got to jump because I just made it to an appointment and somebody's waiting for me that I'm already late. But I will tell you that definitely advocate for that. We are doing that. But definitely advocacy is good because the more commissioners that get behind this, the more opportunities we'll have to do this in different communities. So we don't always get the same welcoming from the different commission districts. So, but adaptive reuse is definitely a strategy. And I'm sorry, David, we could definitely talk about this offline, but I am late to something and I gotta jump.
Thank you, Manny. Thank you for staying with us and talking to us. We appreciate it.
Bye, guys.
Thanks, Manny.
David,
Melissa,
yeah, I
May I
was
also
going to
make a quick
say,
comment? May I also make a quick, very
okay.
important comment about this issue in the chat with Dwight, because this is very, very important. This myth that people are somehow service resistant and they choose to be homeless, that is absolutely a very dangerous and reckless myth. Okay. I've lived in all of the major homeless shelters, Rescue Mission, and Chapman. Chapman is a very good example. They do very good work of providing temporary shelter, and temporary shelters are very good for people that have maybe situational homeless. Say they're normally housed, but they may have had some type of trauma that knocked them out of housing, and all they just need is a few months to get back on their feet. But for the chronically homeless, shelters are effectively useless. They really don't provide, unless they're actually going to serve as a bridge to permanent housing. They don't provide much value. But here's the worst thing about shelters is that the multitude of rules, and I'll have to be very blunt here, the contempt that staff exhibits towards the homeless, towards the chronically homeless, invites violations, invites you banishment, invites you to be kicked out. In fact, I was actually banished unknowingly from the HAC for about a year because of my purported failure to meet with a case manager. The point I'm trying to make here is that the shelters just often compound the trauma on the people. They're like a minimum security prison, and no one willingly walks into a prison. And so this view that because somebody refuses chronically homeless refuses residents within a shelter, that somehow shows that, oh, they choose to be homeless, is absolutely false. Okay, that's simply an indictment on the shelter system, that they'd rather take their chances on the streets than to be further traumatized and punished by a minimum security prison. No one willingly walks into a minimum security prison. So this view, again, that the homeless are service resistant is false. There is no such thing as service resistant people. There are people resistant services.
Thank you so much, David, for sharing that perspective and for sharing all of that. Uh, Were there other questions that folks wanted to ask?
I know as somebody by the name of SK, not sure if you're still on, you asked about master leases. Could you expand on that a little bit? And that will be our last question. Not sure if SK.
Hey, sorry about that. Yes, this kid Nikan Yvonne asked me to come on. I'm a property manager and we have a lot of rental units throughout South Florida. One of the challenges that they're constantly telling me is that they can't handle the rent prices, and we've offered multiple people in different NGOs to work out a master lease program where you'll take 5, 10 apartments, a whole building for a 3, 4, 5 year period, and by default you can control those rates and hopefully keep people in houses for a longer period of time.
Absolutely. So I know that, we have our housing recruitment director here on the line. Yvonne, maybe you want to put maybe connect with the most recent speaker, because these are opportunities that we're looking into, master leasing. And earlier in the call, Melena mentioned shared housing. That is an avenue that we are also exploring, given all the changes that are happening. And I see one more question in the chat. Back to you, Raina.
Yeah, and Audrey, maybe you can answer that a little bit, or I can. But the question is, has MHFA ever considered joining political coalitions in Miami that push for more government subsidized housing, such as Miami's DSA chapter? I've recently joined Miami's DSA chapter, and they regularly push for housing solutions and homelessness solutions. They have housing campaign committee meetings semi-weekly, and I'm sure this nonprofit would get more support and at some point more political representation with more collaboration.
Thanks for that, Rick. So, um, Miami Homes for All is a 501(c)(3), so we cannot be affiliated with a political, um, and we are unable to be affiliated with political organizations or parties. And so, given all of that, um, Miami Homes for All, we do convene a coalition, the Greater Miami Housing Alliance. If you have more questions about that, you can check out our website, www.miamihomesforall.org. Um, and in the Greater Miami Housing Alliance, it's a broad coalition uh, to address affordable housing issues as well as homelessness, including youth and family homelessness. And I think I see Angeli from our youth program manager here in the Zoom. And so she leads helping our Miami-Dade youth, which is part of this broader coalition that we have, Greater Miami Housing Alliance. And so with that, I know that we are getting closer to time. Are there any other final questions from folks? And so again, on behalf of Miami Homes for All, we so appreciate everyone.
Can I make a final comment on criminalization?
Yes.
Yeah, I think we need to address the elephant in the room here. We can't rely, at least for the next 3 years, on the federal government for any type of money for housing. I think, as Manny said, because of some policies being promoted by this really horrific right-wing Cicero group, which has had success at many state levels and in the federal government, essentially the federal government is going to end all federal support for housing, and it's going to push criminalization, and it's going to push involuntary civil commitment and reduction of harm reduction programs. So we can't rely upon the federal government. We can look to the federal government as increasing police presence and prohibiting people to the extent the federal government can from sleeping in public spaces. Essentially, they want to put all of the homeless into they call them sanctioned encampment sites, which are outside of the cities, basically internment camps. Okay, this is not a conspiracy theory. This is actually contained in Florida law. HB 1365 provides for the sanctioned encampment sites / internment camps. if counties actually want to fund them. It's sort of like an unfunded mandate, and counties cannot, or localities cannot allow people to sleep in public. So that's essentially what they want to do: prohibit all sleeping
David,
in
thank you
public
so much.
and promote the sanctioned encampment sites. So here's my point. My point here is that we have to look at public-private partnerships. I believe would probably be a very viable alternative to providing housing rather than relying upon the federal government. And a very good example of that is what the Homeless Trust did with the Bikini Hostel in Miami Beach. And I know we're limited on time. If folks would like some more details on that, I believe that the Homeless Trust or I can give it to them. But I believe that that would be a more productive way to expand the housing rather than relying upon federal monies, which will not be there.
Right. And to that point, I think Miami-Dade has always been quite innovative in trying to address housing and homelessness and creating housing solutions. It wasn't that long ago. Well, it seems like quite some time ago, 30 years now. We created the food and beverage tax, right? And there are other resources that Miami-Dade has to address the housing crisis, but more can be done. And so with that said, we are going to close out this incredible webinar. Again, thank you everyone for joining us here this afternoon. This meeting was recorded. And so what we'll be doing is, going through the video and making some quick edits, and then we'll be posting it on YouTube. And then we will also be writing up an insights report. You can check out the other work that we've done from our other events, the Great Miami Housing Alliance, on our website at miamihomesforall.org. And you'll see there other insights reports that we've published regarding improving permitting, improving HOAs, homeowner associations, and other initiatives that we care about. And I want to say thank you so much to our speakers, Manny, Melena, and Matt. Oh, wow, Triple M. Thank you again for sharing your perspectives on how, what's currently going on and, things for us to keep in mind. I hope you all learned a lot from this session, and may you all have a happy new year. Thank you, everyone.
Thank you, everyone.
Thank you.
Thank you.
Thank you.
Happy New Year.